Hello there, and welcome. We hope that you're doing very well today. And before we start today's tingle session, I wanted to say thank you so much for 100,000 subscribers. Thank you so much for helping one of my dreams come true. It's been such an incredible privilege and journey making ASMR content, and I am forever grateful for your support, your kindness, your understanding, your comments. It all means more than I can ever explain and put into words. I think the best way I can sum up my feelings, my thoughts, simply put, is I have never felt alone, because I know I have friends all over the world. That's you. That's you listening and supporting me. I'm never alone, because I'm rich and plentiful with friends and positive relationships. So thank you for being in my heart. Thank you for being in my life. And I hope that you enjoy today's tingle session. I love you. Hello there, and welcome to your appointment. My name is Dr. Caitlin. How have you been feeling? Okay. Well, if that's the case, then we can start with your eyes. And I'll do my best to test those pesky cranial nerves of yours. Yes. Your eyes will first be tested with this cube with various angles and colors. What color is this right here? Okay. What color is this right here? Great. And coming in as very close as I can. What color is this? And what's this? It's this color right here. And yes, it's almost see-through with this light. And what's this? Yes, you're doing such a great job at following along. As you can see, it creates different prisms, reflections with various movements. So your next test is being able to spot my light as it passes through the cube. So tell me when the pen passes through, okay? Okay. Okay. Tell me when you see it in the center. And tell me when it goes past your view. Good. when it passes above your head. Okay, tell me when it's down below. Side to side, same activity. Good. Good. How many times was that? 2. Switching up hands. I'm gonna go with this sort of in between, okay? Tell me when you see the light go through. Okay? Tell me when you see it. Okay. Follow the light into the cube. Keep watching, keep watching, keep watching. Look at the cube. What color is this? Okay. Ready? What color is this? Just keep following it. It's gonna come in and then go back. Let me know when you see this light. Good. Is it shifting colors? Okay. How about now? Different colors, the same. Okay. Do you see the light passing through? Good. As long as you can see the light, that's what's most important. It's just keeping your eye on this light. And look at me. Hi. How was that? Your eyes. You can have a quick break. Give me a blink. A blink. Blink. Blink a few times. Good. Stay very still for me. Look into your eyes. Have you been experiencing dryness? Okay. Are you addressing that at home with eye drops or a dry eye solution? Okay. Can you blink like that? Okay. This side, can you blink? Okay. Go ahead and stay nice and still. I'm just going to turn your head a little so I can see what's going on. So just blink for me. Keep blinking. Just want to see how it reacts. Okay. Come back this way. Come this way now. And just blink for me. Blink. Okay. So what I'm seeing right now, just a natural redness. You can pay attention to that and address the these lymph nodes. Okay, no inflammation there. When was the last time you were ill? Okay, I'll keep that in mind. Come back to me in the center. And there we go. Coming up next, as I check the facial muscles and their reflexes, I'd like for you to tell me if you feel this right here. It is a exfoliating brush. You can see the texture is nice, risen, little ridges. You'll feel a nice sensation like that. Tell me when you feel that, or if you feel the tip of this brush sharp or dull. Check, okay? Okay. Shut your eyes, no peeking, no peeking, no peeking, no peeking, peeking. And tell me what you feel on your face. Your eyes shut. Okay. That was the sharp side. Great job. Keep your eyes shut for me. One big sweep across. Okay. Yes. This was the dull side. And once again, ready? How many times was that? Okay, once more. How many times is this? Wonderful. Tell me what part of the face you feel this on. So forehead, nose, chin. Okay. Ready? Set. Eyes shut. Okay. Good. Calm down. Yeah, right down the nose. Let's get the tip. Give it a nice boop. Ready? Set. And once more. How many times do I sweep this across your forehead? Ready? One, two, three, four, 5 times. Yes. Great work. For your hearing, let's take a peek. First, with the otoscope. Go ahead, look right at me. Turn you gently to the side. And let's look in this ear. Okay. So, the good news is I'm not seeing redness or dry skin. There's no irritation. And for this side, what I'm seeing is your ear canal looking nice and clean. The skin is nice, flesh toned, balanced in color. Do you have any trouble with your hearing typically? Okay, I'll keep that in mind. So, what I'll have you do is shut your eyes once again. No peeking. No peeking. No peeking. left. Good. Keep listening for the sound. Okay. Yes, I am still on your right side. Good job. Wonderful. How many times do you hear my gloves on either side? Okay. Yes, that was 3 times. But now. Okay, yeah, that was like 4 or 5. I kind of did it a little fast. That was my bad. I was mostly trying to see what side you could hear me on, not how many times. Let's do it right this time. How many times do you hear me? Okay, 3 times. Okay, and again. Okay, and again. Okay, and go ahead and tell me what side you hear me on. Okay, very happy to let you know that the auditory nerves and all the reflex checks. You try saying reflex checks 3 times fast. It's a tongue twister. So I'm happy to let you know that the auditory nerve passed all of the reflex checks and tests that we performed. Let's go back to the facial muscle and check out how different reflex tests do. Give me a big smile with your teeth. Okay. Can you puff your cheeks? Okay. Raise your eyebrows. Do you know how to raise one eyebrow? I don't. If you can, go for it. If you can't, don't worry about it. Could you please touch your nose and then touch my finger? Okay, touch your nose. Touch my finger. Perfect. And I'm going to ask you to gently resist my touch when I press on your shoulders. 3, 2, go. Okay. Once more, I'm going to press a little firmer. 3, 2, go. Just resist. Excellent. What that does is that checks the muscles. If there's any deterioration, any weakness that we need to address, etc. And that's looking great. Is there any additional questions that you have for me at this time? No? Okay. Well, let me get a quick listen to your lungs and your heart, and you can get on out of here until those pesky cranial nerves inevitably get in the way again of your day-to-day. Okay, my dear, breathe in for me. Ready, set. And exhale. Placing this on the belly. Breathe in. Exhale. It's not too cold. Good. Okay. Lower back. Gentle. Breathe in for me. Good. Breathe out. There we go. Upper back. Go ahead and breathe in for me. the quadrants that I was examining sound great, and the stomach had movement within the digestive tract, so that's great. Let's listen to your heart. So, listen for a few moments. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. 71 beats per minute. You're doing great. And with that, that's all the exams, tests, and checks I had for you today. How are you feeling after all that? Very good. That's what we like to hear. So, like I said, I'll be here when your pesky cranial nerves start to bug you again. But until then, take care of yourself.